we talk about surgery, we always have to keep in mind that surgery is always a very personalized approach. Regarding progresses and even game changers that we made in surgery in gynecologic cancers, I think there's a lot of interesting things we experienced over the past 2 years. Let's start with cervical cancer. Now we know that regarding the surgical access, most of the patients can be operated either laparoscopically or even with robotic surgery nowadays. The concept of neoadjuvant chemotherapy is very intriguing in order to reduce the size of the tumor and operate with less surgical radicality. And speaking about less radical surgical treatment, currently there is a very interesting study going on worldwide, the SHAPE study, to assess the value of simple hysterectomy in contrast to radical hysterectomy in patients with early stage cervical cancers. Another important aspect, of course, in this disease that often affects young women is fertility preservation, and also there we made some significant progress for our patients. In endometrial cancer, the most frequent malignancy of the gynecologic cancers in the Western world, we made significant progress regarding the surgical access. Most of these patients nowadays get either laparoscopic or robotic surgery instead of open surgery, which is very important for this cohort of patients with often severe morbidity and obesity that also causes surgical morbidity and even mortality. And so the change in surgical approaches here is very important. One question that is still open is the role of lymphadenectomy, and there we are very happy that just very recently we received the funding for the ECLA study to assess the prognostic role of lymph node dissection. In ovarian cancer, the standard of care is and will stay open radical surgery, and not only open radical, but open radical upfront surgery. However, the question of the optimal timing of surgery has not been adequately addressed so far. So recently, a worldwide study, the TRUST study, started to address the role of radical upfront or radical interval debulking surgery in ovarian cancer. Within this study, we will, by the way, also address the feasibility and the role of laparoscopic assessment of surgical resectability. Vulvar cancer is probably the disease with the most rapidly evolving progress in gynecologic malignancies, where we could establish sentinel lymph node dissection instead of full groin dissection, where we nowadays know that we don't need to have very wide margin in order to have safe surgical results. And recently we started a large translational research project to maybe assess and find out more biological factors that influence the prognosis of our patients with vulvar cancer.